Hello, my name is Amanda Harris. I'm a student at Parkland College. Today I'd like to do a competency video for giving a patient a meter dose inhaler with Symbicort as the medication. The first thing you want to do is review the patient's charts and go over the doctor's orders. You always want to perform proper hand hygiene. Hello, my name is Amanda. I'm a respiratory therapy student. How are you today? Alrighty, would you please verify your name and date of birth? Okay, thank you, Mr. Wilson. So not doing too good today, huh? Okay, well, let me get your vitals. I'm going to get your pulse and your respiratory rate. Okay, so how you do that is you feel for their pulse, you count for 15 seconds, multiply that by 4. Look at their chest, watch the rise and fall for 15 seconds, multiply that by 4. Now you're going to listen to their breath sounds. What you want to do is listen to 3 in the front, starting at the top to the bottom, going left to right, 4 on the back. Top to bottom, left to right. All right. Hey, take some deep breaths for me, Mr. Wilson. Okay, doing great. Let's sit up. Let's get the back here. Okay, take some deep breaths for me. Hey, you did great. All right, a little wheezy in there for sure. Okay, how about you do some huff coughs for me? Let's get some of that out of there for you. Remember how to do that? It's kind of where you go, kind of gets everything flowing. I'm going to give you a tissue here. Okay, if you have anything you need to spit out, you do that. So I want you to get it all out. All right, good job. Thank you. Okay, the next thing I want to do is we're going to check your peak flow. Do you remember how to do that? And take in a nice breath and then forcefully exhale. Just give me one good. Okay, I'm going to put this spacer on. You just wrap your lips around that. Again. Okay, please do that. All right, thank you. Pretty good. All righty, so now we're getting on to the doctor's medicine that he's prescribed. Okay, this is Symbicort. This is not a fast-acting inhaler. If you start feeling all wheezy and have an asthma attack, this is not the medicine to use, okay? It's not going to help you at all. In fact, this could actually give you bronchospasms. I don't want you to be concerned if you do. I mean, it's the type of medicine, it can do it. But what I really need you to do is wait about 5 to 10 minutes before you use your albuterol. Give this medicine time to work, get things going, and then use your albuterol, all right? But don't be concerned. It's just the way this one seems to work. Another important thing I really want to tell you is that this medication has a counter. On top here, when it hits yellow, that's at 20. This is when I want you to call the doctor and make sure you have another prescription waiting for you at the pharmacy. Don't wait until you're out. You don't want to do that. We need to prime these. Okay, so how you prime these is you shake them, take the lid down, spray once. Shake again, spray again. Okay, you may need to do this if you let it sit 7 days, but don't do that because I want you to take this twice a day, 2 puffs twice a day, morning and night. But if something happens and it's sat over 7 days, you must prime it. Or if you use to drop it on the floor real hard, then you need to reprime it. Now the way you take this dose is you're going to want to shake it, and you're going to spray it into your mouth while you have airflow. And what I mean by that is you don't want to spray first, and then, because then it's going to land on your tongue, and you don't want to be like real quick at the same time. It may just hit the back of your throat. We really need to get these in your lower airways. So you're going to want to shake it, put your lips around it, bam. So right after you start that, then I want you to hit this directly after you start your inhalation. Okay, so shake it, hold 10 seconds, blow out, shake again, and hold 10 seconds. Okay, and then you will be done. All right, with this one, it's corticosteroids. So the next thing I want you to do is to take a drink, rinse your mouth real good, swish it around, and then spit it out. You don't want to swallow it. Just rinse and spit. Okay, do you have any questions? All right, so what I want you to do is I want you to do this the first time so I know that you know what you're doing. I want you to pretend you went to the pharmacy, you just got home. I want you to show me how to prime it, you know, how you know when it runs out and how to properly take the medicine. Okay? All right, thank you. So after they demonstrate that they know how to do it, what they're doing, you're going to reassess your patient. You're going to get their pulse, you're going to get their respiratory rate, you're going to listen to their breath sounds, and you're going to take a peak flow. And at all times when you're assessing a patient, from when you first walk in the room, you always want to make sure that you're watching for their work of breathing, you're checking their skin color. All these things are very important. And then before you leave, remove your gloves and do proper hand hygiene. Alrighty.